Now, it is the second day of the Presidential Health Summit taking place in Boksburg, this in Gauteng. Experts, including stakeholders in various healthcare fields, are considering how to reinvent healthcare to serve the majority of the population. Just yesterday, teenage pregnancy was the focus, but today, President Cyril Ramaphosa is expected to address the summit. So let's bring in now Professor Liesl Zühlke from the South African Medical Research Council joining me this morning. And thank you so much, Prof, for your time. Good morning to you. Let's talk about some of the current health threats that you have identified, I suppose, not only at the summit, but as experts generally in South Africa.
Yes, thank you very much for the opportunity. Yes, we spoke about this in great detail yesterday. The four major health threats that we've been dealing with, not only at the moment, but over the last decade or so, really falls into four camps. So the first is around infectious diseases. And there our previous focus was, of course, HIV and TB, but now we include COVID-19 into that. Then we have our non-infectious diseases or our non-communicable diseases. These are things like cardiovascular disease, stroke, diabetes. And I presented data on all three of those areas and how they are increasing in the country. We then looked at maternal, childhood and neonatal health. Also very critically important, our maternity mortality rate, our neonatal mortality rate, our under 5 mortality rate. And then finally, something that is of importance to each of us every day is the issue of violence and injury and how that's also been affected by COVID. So our discussion yesterday was focusing on those four threats, but also seeing what has happened with those four areas during the COVID pandemic and now since the COVID pandemic, or since we are recovering from the COVID pandemic.
So definitely taking note of the infectious diseases, non-infectious diseases or non-communicable, maternal violence and injuries. But Prof, I can imagine there are also future threats to healthcare that you have identified.
Absolutely. And one of the first ones of those that we talked about, I'm just looking at your screen at the moment, and in the top right-hand corner, you've got blackout stage 4. Load shedding is certainly a health threat in many ways. We also talked about climate change. Very important. Health, mental health and well-being, and how we are experiencing really a change in terms of and an increase in mental health issues. We talked about aging and the elderly and how our demographics changing in this country with more and more older people in the country. And of course, we talked about this incredible risk of poverty and how poverty and a difficult social environment, how that actually affects healthcare.
Right, and Prof, I have to leave it there, and I understand that, of course, as President Cyril Ramaphosa is expected to address today, some of those interventions are expected to be pronounced by the President alongside experts. But thanks for joining us, Professor Liesl Zühlke from the South African Medical Research Council, updating us on some of the threats to healthcare that we need to take note of as a country.